Stage 1 varicocele, grade 4 reflux, what is also called as the backflow of the blood. He gets treatment done. Veins is more than 3 mm and now he has grade 4 varicocele. How do I confirm that there is varicocele? Or what is the grade of my varicocele? These are the questions often asked to us by the patients, and let us today answer these questions and try to understand. Hi, I'm Dr. Shahnawaz. I work as Senior Consultant Interventional Radiology at Max Hospital, Saket, New Delhi. Let's try to understand the answers to these two questions. The first question is, how do I confirm that I have got a varicocele? The answer to this question is that the varicocele is often diagnosed clinically based upon the symptoms. But the confirmation of the diagnosis comes from the ultrasound Doppler. Ultrasound Doppler is the imaging modality of choice to diagnose a varicocele. Ultrasound Doppler is basically used to look for three things, and if these are present, we can be sure there is varicocele and even grade the varicocele. Number one, the diameter of the veins. We all know that varicocele is basically a bunch of dilated veins around the testes. So the first thing done on the ultrasound is to measure the diameter of these veins. If the diameter of veins is more than 3 mm, it is suggestive of varicocele. The other thing which is done on ultrasound Doppler is to look for the reflux. Reflux, what is also called as the backflow of the blood into the scrotum. If there is a reflux, it is again suggestive of varicocele. And the third important thing seen on the ultrasound is the testicular size. If there is a reduction in the size of the testes, it is again suggestive of varicocele. The second question which we just asked is, what is the grade of varicocele? To understand the grading of varicocele, we need to understand a term called as Valsalva maneuver. Valsalva maneuver is basically a simple holding of breath and exerting pressure into the chest and the abdomen. In case of varicocele, it is usually done during the Doppler to try to increase the pressure inside the abdomen. When the pressure inside the abdomen increases, it tries to push the blood out into the varicocele. And if we are able to see it during the Doppler ultrasound, we can confirm the diagnosis, and we can also grade the varicocele based on this reflux. To make it simple, varicocele is graded into 5 classes or 5 stages: 1, 2, 3, 4 and 5. Stage 1 varicocele is when the reflux starts in the abdomen and reaches up to the groin crease, that is called as the inguinal canal. If it goes further down and reaches up to the upper part of the scrotum, it is grade 2 varicocele. If the reflux reaches the lower part of the scrotum, then it is grade 3 varicocele. And if this reflux occurs even without Valsalva, it occurs spontaneously, that means there is grade 4 varicocele. And if there is decrease in the size of the testes besides these refluxes, then it is grade 5 varicocele. So grade 1, 2, 3, 4 and 5. 1 up to groin crease, 2 up to upper part of scrotum, 3 up to the lower part of the scrotum, grade 4 when there is spontaneous reflux into the scrotum, and grade 5 when besides reflux there is shrinkage in the size of the testes. Why do we need this varicocele grading? The answer is simple. First, we learn the severity of the varicocele. Second, we can understand if our varicocele is progressing over time. For example, if somebody had grade 2 varicocele 1 year back and now he has grade 4 varicocele, that means the varicocele has progressed over time from grade 2 to grade 4. Third, for treatment response, somebody for example had grade 4 varicocele, he gets treatment done and now there is no varicocele or grade 1 varicocele, that means the treatment has helped him. So this was all about varicocele diagnosis and it is grading. If you have a question about varicocele, you can drop us below in the comment section. You can also text us or WhatsApp on our phone number if you have got any question or you want to share any records with us.